All right. Good afternoon, and thank you everyone for joining today's webinar, New Approaches for Identifying and Addressing Learning Disabilities and Mental Health Challenges Among TANF Participants. We work very closely with our colleagues in the Department of Labor's Office of Disability Employment Policy. I'll be calling that ODEP. That's from this point forward, to bring together a wonderful panel of expert presenters to discuss this important topic with you today. My name is Lisa Washington Thomas, and I am the branch chief for the Self-Sufficiency Branch in the Office of Family Assistance in the Department of Health and Human Services. This webinar will explore promising practices and programs from TANF programs and Department of Labor grantees that help TANF recipients with a disability move toward employment. In addition, it will examine opportunities and challenges in providing supports and services, as well as strategies and approaches such as customized employment, being used to help recipients with a disability secure and maintain employment. Finally, this webinar will explore opportunities for partnerships between TANF, disability, and workforce programs to promote employment outcomes. We are so pleased to have 5 dynamic presenters who will be leading our conversation today. Throughout their presentation, you will have an opportunity to ask questions through the Q&A box in the bottom left corner of your screen. We encourage you to ask questions, and if your question is for a specific presenter, please annotate who you would like to answer your question. If we don't get an opportunity to answer all the questions, we will develop a Q&A based on this webinar and reaching out to our presenters, and it will be posted on the PeerTA website. That address is peerta.acf.hhs.gov, along with a transcript and audio recording of today's webinar. During this webinar, there will be a series of polling questions that will appear on your screen. Please answer each by clicking on the radio button next to your selected response. Doing so will not only help us guide the discussion, but it will also share additional information that may inform your practice. I would like to give an opportunity for our colleague at ODEP to provide a brief introduction. Please allow me to introduce Amy Gonzales. Amy is a Senior Policy Advisor for the Workforce System Policy Team at the U.S. Department of Labor, Office of Disability Employment Policy, ODEP. Amy has managed various projects at ODEP, some of which include developing and maintaining state and federal partnerships to expand competitive integrated employment outcomes for people with disabilities under the Workforce Innovation Opportunity Act. Additionally, Amy has supported the development of policy and capacity building through working with Employment First States and ODEP's Training and Technical Assistance Centers. For the past 17 years, she has worked to support the advancement of people with disabilities in a variety of systems, such as education, vocational rehabilitation, and workforce development. Amy has a Bachelor's of Arts degree in psychology and a Master's of Science degree in rehabilitation counseling from the University of Texas, Rio Grande Valley. So I am so pleased to introduce Amy, and it's been great working with you, and I hope that we continue our partnership into the future. Amy Gonzales.
Thank you very much, Lisa, for the wonderful introduction. Good afternoon, everyone. As Lisa stated, my name is Amy Gonzales, and on behalf of the Department of Labor's Office of Disability Employment Policy, we would like to thank you for taking the time to participate in the webinar today. ODEP is excited and honored to participate with OFA in this capacity, and we hope that you will find the strategies and best practices useful for the people with disabilities that you serve in your respective state TANF program. ODEP is a non-regulatory federal agency that was created by Congress in 2001. We work with federal and state agencies and employers to improve the workplace success for individuals with disabilities. There is not one specific target population of disability that we focus on, but an array of disabilities. So whether somebody has a physical disability, a mental health challenge, intellectual and developmental disability, learning disability, we work to support the advancement of that person in the workplace, regardless of their specific disability. We fulfill our mission and our goals by advising the Secretary and other offices within the Department of Labor, and by coordinating with sister agencies by providing that technical assistance. In addition to what was mentioned earlier, we also have several priorities that we do work on at ODAP. Just like the slides say, what we do is we try to analyze and research and evaluate existing practices and policies so that we are trying to improve and expand upon these resources. We also try to work with states and federal partners and employers to enhance policies, really to ensure that people with disabilities are able to obtain a job, but also to keep those jobs, to maintain employment. And we also conduct extensive outreach with our stakeholders and other interested parties to broadly educate and inform of the talents and the strengths that people with disabilities bring to the workforce system. We are very big collaborators here at ODAP, both internally and with external partners. And I think a wonderful example is the webinar that we are facilitating today with OFA. We also collaborate with nonprofit agencies, and then, like I said before, we provide that technical assistance depending on the need and the goals that the agencies have. I mentioned earlier that we partner internally. We have 4 policy teams at ODAP, which are 4 of the teams that we work very closely together with: employment-related support, workforce systems, employer and workplace policy, and youth policy. So we all may have different projects, but they all feed into that broader mission, which is to help people with disabilities keep a job, maintain a job, move up the career ladder, and really work through any barriers that they may have. Some of the other key issues that we are focusing on, as you will see, is mental health, veterans. Some of you are probably wondering, well, how do they work on transportation? And so, yes, we do target certain populations, but we also work to identify the barriers. And I am certain that most of you on this webinar today are familiar with the barrier in transportation and childcare and some of those other vital services needed to help an individual obtain employment and keep their job. And so we also work with stakeholders to ensure that we're trying to be innovative in developing strategies and policies and resources to break these barriers to employment. So in addition to what was mentioned just earlier, the webinar will also provide a context for the connection between disability, TANF, and intergenerational poverty. We're also going to share information on evidence-based approaches that offer universal design strategies for youth on TANF and or families receiving TANF support. We're going to provide information on different user-friendly strategies for implementing customized employment, which is another universal design evidence-based approach to employment that really ensures a stronger job match with higher job retention rates. We're going to highlight some states that are implementing successful practices to engage and support people with disabilities and promote employment. And we're going to share resources that can assist TANF program staff in designing programs and providing services that promote employment outcomes for adults with disabilities. Next, I am going to introduce some of the ODAP speakers. Mindy Larson, Dr. Rebecca Ceylon, and Marie Parker. Mindy joined the Institute for Educational Leadership in 2010 and serves as a Workforce Development Technical Assistant Liaison. She conducts research, analysis, and program evaluation of policies, programs, and practices, and also provides guidance to the workforce development system nationwide. She also creates training materials and conducts workshops and symposia locally and nationwide. Mindy formerly worked for the D.C. Department of Youth Rehabilitation Services doing youth offender work. Next is Dr. Rebecca Ceylon. She is the project director of ODAP's National Center on Leadership for the Employment and Economic Advancement of People with Disabilities, which is led by the National Disability Institute. Dr. Ceylon is a recognized national leader in policy and program development with an emphasis on the Workforce Innovation and Opportunity Act from a disability perspective. She has over 35 years of experience working with people across the spectrum of disabilities in both the private sector and for the D.C. state government. Marie Parker has been at Transcend, Inc. since 2004. She is a program director and county liaison for the Montgomery County Customized Employment Public Intern Project in partnership with the local American Job Center and Montgomery County government. As the county liaison, Ms. Parker identifies and creates part-time position in the county government by using the customized employment approach. You will hear from Marie today the goodness of fit that customized employment has for all people with disabilities, such as learning disabilities, intellectual developmental disabilities, and mental health challenges. Now I'm going to turn it over to Stephen Broyles, who will introduce the presenters for Utah. Thank you very much.
Thank you, Amy, and good afternoon, everyone. We're going to begin with the introduction of Utah, and before we do go there, we're going to make sure we go ahead and do our first poll question. And our first poll question is, you use evidence-based approaches and promising practices that improve employment outcomes for TANF participants who have a disability. And we'll give you a moment to go ahead and click on the radio buttons. Again, the question is, we use evidence-based approaches and promising practices that improve employment outcomes for TANF participants who have a disability. And as our responses are coming in, we're showing that a majority of you do, and we do have some that are unsure. So that will provide a good segue to our first presenters. Ladies and gentlemen, please let me introduce to you Marian Eckersley and Christine Anderson of the Utah Department of Workforce Services. Marian Eckersley is a state program specialist for the Utah Department of Workforce Services and has 17 years of experience in working with TANF policies, contracts, and projects. Most recently, she's been involved with the development and implementation of the Workforce Services Next Generation Kids Invest in U2 program. This is a career pathway program that was created to provide supportive case management and soft skills training while the participants are attending vocational classes. Marian has been involved with changing the focus of Utah TANF case management from customer to family focused and testing new strategies to reduce the incidence of intergenerational poverty. Marian earned a bachelor's degree at the University of Utah in Behavioral Science and Health. Christine Anderson is the Davis District Director for the Utah State Office of Rehabilitation. She recently completed her EDS degree in Rehabilitation Counseling and has a master's degree in Rehabilitation Counseling as well, both from Utah State University. She was selected to participate with the URLIN project, addressing the needs of children and youth with special health care needs administered by the Department of Health and Human Services. Prior to continuing her graduate studies, she was a counselor at the University of Utah Center for Disability Services. Christine is also a certified child life specialist, where she worked with hospitalized children in the Neuroscience Rehabilitation Unit. Her research interests include ethics, cultural and linguistic diversity and the transition process, and counselor development. She has previously served on the URA board, the American Counseling Association student chapter of the Utah State University, and is currently a board member for the Utah Alliance for Children. I'd like to introduce to you again Marian Eckersley and Christine Anderson. Thank you.
Thank you for that introduction. I appreciate the opportunity, along with Marian, my colleague, to present information about our Invest in You and the Vocational Rehabilitation Partnership that's part of the Department of Workforce Services in Utah. Slide. TANF recipients are families experiencing extreme financial difficulties. In addition to the limited financial stressors that families often are at increased risk for additional stressors, which include food stability, housing crises, and relationship issues, including domestic violence. The stressors build, and the individuals may not be able to identify adequate methods to mitigate the stressful circumstances they are experiencing. Oftentimes, individuals have underlying disabling conditions that present challenges to coping, including their mental health disabilities, physical disabilities from trauma or the trauma they're recovering from, and learning disabilities that have limited the family's ability to achieve their education and employment. The services provided in the human services often look at an individual model of intervention. However, a family systems intervention is needed to address the issues for families in order to provide assistance to their children, the school support where their children are enrolled, or for the parent support, and for the community support that's available. This includes building a supportive network of families who trust each other, have supportive professionals, and that way they can develop the trust and access the supports available to them. Slide. Vocational rehabilitation, or VR, as we often refer to it, is a federal program administered by the Rehabilitation Services Administration, or abbreviated as RSA. Each state has a program, and some states house their VR program under the Department of Education, sometimes the Human Services, or Department of Labor. In this case, in Utah, we are housed under the Department of Labor. RSA provides funding and oversight to ensure services are administered to individuals with disabilities to make sure it's done in an equitable manner. The mission of VR, Rehabilitation Services, is to assist and empower individuals with disabilities to achieve and maintain meaningful employment. They can also become acquainted with the work identity. Sometimes when you meet an individual for the first time, they ask your name and often ask, what do you do? And if you don't have an opportunity to have developed a work identity, this again presents challenges for an individual and also impacts their self-worth and who they are. So employment and work provides opportunities for individuals. This includes community engagement, having a sense of well-being, and individuals who contribute to the national economy. In addition, there is accomplishment and self-esteem that grows within the individual's employment provides opportunity and achievement. Slide. So who receives services? Well, individuals are determined eligible for the VR program based on whether there is a physical or mental impairment and whether the impairment results in a substantial impediment to employment. And does this individual require VR services? And can the individual benefit from the employment? So in looking at eligibility for our program and for TANF recipients, it's important to understand that to see how that can be a part of the VR process in our partnership. So this can include TANF families who struggle with mental health issues, including depression and anxiety, which often presents as difficulty managing their mood and being able to attend training, being able to attend work. Maybe it's an explosive outburst at work. That can lead to a loss of employment. Sometimes it's difficulty maintaining attendance at work, physical disabilities that may have resulted from domestic violence, or even PTSD. Learning disabilities that have presented often make challenges for completing high school and education and getting post-high schooling. Disabilities can also have co-occurring disabilities in mental health, and as a result, there's increased stress in the home. Slide. So part of our collaboration and wraparound services in accessing VR and the TANF recipient Invest in You project at Utah is our joint project for VR as part of our division of the Department of Workforce Services. This is a unique opportunity because it presents for free communication. We have the ability to have one release of information so that we can exchange information about our participants and clients. It means we can review and share resources. One division may have funding opportunities that VR doesn't, and VR has funding opportunities that our TANF Invest in You project has. This allows us to have that exchange of information and develop comprehensive wraparound services. Our department, because we are housed in one area, is very supportive our service professionals to attend appointments and meetings for our shared clients. This enhances our communication. We feel a great sense of collaboration, and our TANF recipients feel that support and know that when they release information or express concern to us, that it will be handled in a professional, confidential manner, as well with comprehensive services. So this model is effective interaction and helps us problem solve for our clients. The level of service that we provide helps us provide TANF recipients to achieve the best possible outcome, which is, of course, employment. I now turn it over to my colleague, Marion, to tell you a little bit more about the Invest in You project.
Hello, everyone. I'm going to talk a little bit about the Invest in You 2 project that we started in Utah a couple of years ago. After hearing a presentation from Climb, Wyoming, we came back and decided to look at applying that same concept with our TANF customers. We were already familiar with some of the industries that were in demand and had positions open that did not have enough qualified candidates. We learned a little bit more from Climb Wyoming on their model, and then we made some adjustments based on our needs and policies. We'd already been working with some TANF participants experiencing intergenerational poverty with our Next Generation Kids program. So using the same concepts of family focus and intensive case management, we decided to start this cohort pilot with single mothers on financial assistance. As we implemented this model, we've seen participants and mothers develop an understanding that there's not alone, there's other people out there like them going through similar situations. They become a cohesive group early on in the project and start to support each other. We've seen that the support and the cohesive group builds their confidence. We also continue with the family focus with this group and include the children in some of the evening activities so they can see what mom is doing and the families even get more close. With this model, we work closely with both industry partners and educational institutions. The first step we took was look at some of the industries that were in demand in our area and also above average wages. We wanted to ensure companies we worked with offered good benefits for our participants and room for advancement. We also wanted our participants to get a career and not just a job, and one that they could be proud of and grow in. So meeting individually with employers and developing a working relationship actually was a big key to getting some of our participants employed quickly. When we developed the curriculum, they had input on what they wanted on the soft skills and what they needed to learn to be successful in their companies. As they've hired graduates, many have noted that the quality coming out of our program is above and beyond other applicants. We've even now have them asking when the next cohort will be complete because they would like to hire them. We also met with the school. We worked with Salt Lake Community College for this program, and they had already offered this training in the industry of medical manufacturing, but it was a 4-month program. A lot of our TANF participants don't want to take 4 months to finish a program and start earning money. So what we did was we worked with them to change that program and make it into a 13-week program, which is very intensive for the moms, but they were able to complete fast and get jobs and start earning a wage. The schedule was only for the cohort, so to allow them to create the bond, we didn't allow other students who were not part of this program into this 13-week program. Staff actually had to adjust their roles when they worked on this. We took existing staff that were working with TANF case managers or TANF customers already, and they kind of needed to change it to being not just a case manager, but also a job developer, writing curriculum, a trainer, and continue their case management. With the cohort, we had 2 case managers and a licensed clinical therapist attached to each cohort. The therapist actually needed to change his schedule a little bit, also into developing curriculum and training, and continue to meet with participants one-on-one. So during the 13-week program, participants dedicate 40 hours per week to classes. It's pretty intense, but we like to get moms prepared to go back to work at 40 hours a week. During this time, they attend college and vocational training, and then they're with the case managers receiving soft skills training and structured study time. We group the soft skills training into 4 different categories. Life skills, which includes workshops like assertive communication, conflict resolution, and budgeting. Success in the workplace includes workshops like every day is a job interview, interacting with coworkers, problem solving, and leadership. Our LCTs do psychoeducational workshops, and some of their workshops include stress management, test anxiety, and thinking errors. And then we also have work readiness, which includes resume building, interview skills, and time management. Between the workshops, we also include getting to know you activities and team building activities that prepare them to get into the work and work with other coworkers. It's very hands-on, these getting to know you activities, and the employers have actually recommended that we do this because the work that they will be doing requires hands-on attention to detail and detail writing. So we make our activities apply to what work they'll be doing. This chart shows the number of participants that were experiencing obstacles in our last cohort before and while they were in the program. In addition, many participants also experienced struggles with their own families, telling them to leave the program. It was just a waste of time and they just needed to get out and get a job. When we looked at the participants that joined our program, even though we didn't focus on just IGP, 73% of them were intergenerational poverty. So it was difficult for them to stand up for themselves. They've learned that you just get a job so you can start paying your bills. But they'd been in a position always to be available and had low confidence. But during this program, we taught them to stand up for themselves and help their family realize how it's going to help in the long run. At the end of each program, we have a graduation, and then we will see some of these same family members cheering them on and really realizing the time and effort that really made a difference. We've even received letters after the program from family members talking about how it made a difference in the life of the mother and their children. There's many times participants want to give up when these struggles or their obstacles come up, but their relationships they build with the other students and with the case managers helps them continue on. We've had 2 moms in the current cohort that have experienced severe domestic violence and came to school the next day with black eyes because they knew it was a safe environment and they could get help, and they wanted to continue on so that they could be on their own and support themselves. So despite what was going on in their lives, they learned to problem solve and they believe that they can do it. So this slide is a sample timeline that we use for each of the cohorts. When we're marketing to community partners and participants, we like them to know that it's an intensive selection process. We've identified participants are best when their motivation shows. So they're required to complete an information meeting that talks about the industry that they'd be training for, but also we have them do an interview with the case managers, the licensed clinical therapist, and also a writing assignment. From our first cohort to our current cohort, we've learned through interviewing to look at motivation. You can't always be correct in what you're measuring because motivation is hard to look for, but we've had more success as we looked at what they need. With our first cohort, we really focused on their abilities, but we know that the motivation is what made the difference in the cohort success. So I just wanted to give a few of the outcomes that we've had in our cohort 1 and 2. We're currently in cohort 3, so I don't have that outcome yet. Combined cohort 1 and 2, 85% that entered the program completed the program. And then before they even completed the program, 76% were already employed. the way we do that is we have such a close relationship with the industry. Before they graduate, about 3 to 4 weeks before graduation, we start having them apply for jobs, and we have one contact with each employer, send their resume over and let them know that they applied for the job. As the employers have become more confident in the participants coming out of our program, they get them in and interview them right away and are very likely to get a job. I listed the starting wage separately. Cohort 1, their starting wage was $11.98, which was a lot more than anyone in the cohort was making beforehand. But Cohort 2 was moved up to $14.36, and that was in a short year period. And that's just because the industry is in such high demand that the employers are competing against each other, which is increasing the wages. So these employees actually have a great opportunity to stay with the company and grow with the company and advance. So what we presented today was a high-level overview. Obviously, there's more detail. So if anyone would like more information on these programs, we've just listed our contact information, and we'd be glad to help.
All right. Well, thank you very much, Christine and Marion both. And what we'd like to do next is move to our next poll question. So the second poll question will be, we work with our local American Job Center to assist our TANF participants who have a disability. And again, the choices are yes, no, or unsure. So take a moment to click on the radio button. Again, the question is, we work hard with our local American Job Center to assist our TANF participants who have a disability. And we'll give you a moment to respond. Okay, we can begin to show our results. And we see that a number of you do work with the American Job Centers. And that's great as we move into our next presentation. So we will now hear from Mindy Larson from the Institute for Educational Leadership.
Hi, everybody. I'm happy to be with you today. I work for the National Collaborative on Workforce and Disability for Youth, which is housed at the Institute for Educational Leadership Center for Workforce Development. We're a national nonprofit based in Washington, D.C. NCWD Youth is a national TA center funded by ODEP that focuses on all youth, including those with disabilities and other disconnected youth, to ensure that they have access to high-quality services in integrated settings to achieve employment and independent living. A primary part of our work is providing resources and assistance for service providers who are working with youth in the workforce development system and other human service systems as well on inclusive strategies for strengthening workforce development service delivery. And we also have a big focus on providing guidance and tools for improving the competencies of the youth service professionals. So the TANF service providers working with youth and young adults, job developers, and other workforce development system professionals who are working with the young adult population. Building their competencies is a high priority because we know that the staff who work on the front line make all the difference in engaging and motivating and ultimately supporting the success of the individuals that we're serving. We also engage youth and families in developing their own self-advocacy. And some of our work emphasizes informing policymakers to improve state and local policy. So today we wanted to highlight a couple of resources that are potentially very useful for TANF service providers for strengthening your services to individuals with disabilities, including young adults. The career planning begins with assessment guide. Is designed for service providers to help them better understand how to use assessment strategies to support young people with educational and career development challenges. And our guide focused on youth with learning disabilities is called Charting the Course, Supporting the Career Development of Youth with Learning Disabilities. I'm going to just briefly describe and give you a preview of what these resources offer in hopes that you'll take a look at them and delve more deeply into learning how they can be of use in your work. So the assessment guide focuses on understanding assessment and different assessment strategies and how to use them effectively. So assessment primary definition is a process of collecting data for the purpose of making decisions. And we want to be sure that any data we're collecting is purposeful and meaningfully used. It's an important part of the career planning process to make sure that we're examining the individual's interests and abilities so that we can establish a plan for serving them and engaging them in career development, training, and employment that fits the individual. The guide provides a great overview of assessment, what it's all about, different types of assessment, different types of assessment activities and instruments that you can use, as well as key principles that we should be following as professionals when we're engaging with clients in assessment activities. It also provides a lot of information about different types of disabilities, including learning disabilities, mental health disabilities, and substance abuse disorders, and how that interplays with assessment activities. There's also lots of quick reference charts and sample forms that can be used by service professionals. Some principles that are emphasized in the guide and important to keep in mind is that self-determination be based on informed choices, and that's an overriding goal. So we're really trying to use assessment to inform choices and make sure the individual is having the information they need to decide for themselves and in cooperation with the service provider. Assessment is a dynamic process, meaning it's not an end unto itself and it's purposeful. We need to be using the information we get from assessment in meaningful ways and putting it to good use. The purposes and goals of assessment should be clear to everyone involved, especially the individual being assessed. And it's really important to build rapport with that individual ahead of time and make sure that they have buy-in and understanding of the assessments they're being asked to participate in and what the information will be used for. Assessment should be integrated into a larger plan for individualized services. So again, it's information to be used for planning services that are relevant for the individual. Assessment should consider environmental factors affecting the individual. Any reports coming out of assessment should be written easily understandable language so that the person who's been assessed can get information that they can understand, and time and effort should be put into helping them understand how the results apply to them and how to use that information. Finally, assessment activities should be a positive and empowering process. A few things about assessment. It's typically a part of what happens when an individual enters a program. So the initial interview, as any individuals entering a TANF program, for example, or other workforce program, should be focused on establishing rapport with the individual and their family, and making sure that you can to help them develop a realistic understanding of what the agency has to offer. The personal information about their health and disability issues may be a part of that interview process and should be handled with tact and sensitivity. So we really want to be clear that privacy and confidentiality must be maintained, and as information is secured from other agencies, it must be done in ethical and legal ways using signed consent forms when needed. Youth service providers, one-stop centers, and other entities should be aware that the non-discrimination requirements of the Workforce Innovation and Opportunity Act, Section 188, outlines guidelines for this. There's a soon-to-be updated Section 188 disability checklist that will be available from ODEP in the U.S. Department of Labor that will assist in compliance when conducting initial interviews and administering subsequent assessments. A young person or individual's assessment data may suggest previously unidentified or undiagnosed problems that may be affecting their career planning and their career development and transition to work. These problems may include low literacy levels, inconsistent academic performance, limited vocabulary or lack of proficiency in English. Learning disabilities, behavior disorders, mental and physical health problems, and other hidden disabilities may be present. So what we really need to be doing is engaging individuals in a screening process to determine whether further diagnostic assessments should be provided if there are signs of potential problems. Screening is done to determine if more specific diagnostic tests are needed. Qualified professionals must be the ones that administer diagnostic tests and assessments. Service providers should be trained on how to use specific screening tools as a first step. So the next resource we wanted to briefly highlight is our guide on learning disabilities. The guide helps service providers understand more about learning disabilities, and that it's a neurological disorder that means that the individual, their brains are wired differently. They may be smarter than their peers. However, they may be processing information in different ways. Some signs that the individual may have a learning disability is that they may exhibit difficulty reading, writing, spelling, reasoning, recalling, and or organizing information if left to figure it out on their own, and in situations where they're being taught in conventional ways. So the guide provides some really helpful strategies for service providers on how to help people with learning disabilities achieve success by accentuating their strengths and knowing their weaknesses, and then employing learning strategies for dealing with their specific difficulties. The guide focuses in 3 areas. Strategic learning for the workplace is about processing, is a process of incorporating specific tools and techniques to understand and learn new material or skills, to integrate new information with what is already known in a way that makes sense to that individual, and to recall the information or skill later, even in a different situation or place. Individualized development strategies focus on teaching and learning strategies and on how and when to use particular strategies. It also includes strategies and tips for increasing the individual's ability to engage in self-regulated planning, monitoring, and evaluating of their learning. A chapter on disability and disclosure and accommodations focuses on preparing the individual for the process of discussing their disability with others for specific purposes of understanding how and when to disclose in school and work and social settings. It also provides information on accommodations, including physical, environmental, or procedural changes that can be made in a classroom, in a work site, or even in assessment activities that can help people with disabilities learn, work, and receive services. Finally, we just wanted to make you aware that we have a set of resources focused on those with mental health needs, all different kinds of mental health conditions, and what kinds of supports and strategies can be employed to help address that and remove barriers to employment. So there's a guide called Tunnels and Cliffs, as well as a couple of different information briefs. The slide shows a link to one of those briefs, and also a case studies report that highlights several workforce programs that and how they have employed different strategies to support transitioning youth with mental health needs. Please don't hesitate to contact us if you have questions at any time. We are available to answer questions as well as provide more in-depth technical assistance and training around serving youth with disabilities. We look forward to the potential of hearing from you.
And thank you very much, Mindy, for that presentation. And before we go into our final presentation, we'll bring up our final poll question. And that question asks, you are familiar with and use customized employment as a strategy in your work to match candidates with employers. And again, your responses are yes, no, or if you're unsure. And we'll give you a moment to begin to enter your responses. And again, that question was, we are familiar with and use customized employment as a strategy in your work to match candidates with employers. Okay, we can begin to broadcast our results. And we see that a number of you are a little unsure about whether or not you use that approach. So that is perfect for our next set of presenters who will be able to address some of that. So finally, we will hear from Dr. Rebecca Salon of the National Disability Institute and Marie Parker of Transcends, Inc. Thank you.
Thank you so much. Hi, this is Rebecca Salon. Marie Parker and I are going to be talking about resources and partnerships to support employment outcomes, equal opportunity, and the inclusion of people with barriers to employment in employment programs. We are with the LEAD Center, which is the National Center on Leadership for the Employment and Economic Advancement of People with Disabilities. And we're a collaborative of disability, workforce, and economic empowerment organizations led by National Disability Institute with funding from the Department of Labor's Office of Disability Employment Policy. And we wanted to start with a little context as one of our focuses is on economic advancement for people with disabilities. And there's such a clear link between disability and poverty. So from ACF's data from 2017, there are 1.2 million families on TANF, and of those, 1 million are adult recipients. And what we know from research is that the numbers of people with disabilities are hard to quantify because there are different definitions of disability out there, but regardless of how we look at it, somewhere between 35 and 43% of adult TANF recipients have a disability. So more than a third, more than 1 out of 3 people with people who are on TANF have disclosed that they have a disability. And that the poverty rate in general for working age adults with disabilities is more than double the numbers of people without disabilities. So the poverty rate for adults in general with disabilities is incredibly high. And one of the interesting things about that is that disability is both a cause of poverty because of a number of reasons, but because of lack of opportunities and low expectations and not having strategies that really meet their needs, and we'll talk about that a little bit. But also disability is a consequence of poverty. So people who live in disability their whole lives or who are in intergenerational families who are living in poverty are more likely to develop disabilities. The research also shows that people with disabilities experience extreme financial stresses. So people with disabilities are almost 3 times more likely to have extreme difficulty paying bills. They're also twice as likely to be unbanked, which means that they probably are using more expensive ways to manage their money. And as important, people with disabilities are almost 2 times more likely to skip medical treatments because they can't afford them. So that, again, that keeps people out of the workforce, has all kinds of effects. We heard in the Invest in You presentation earlier from Utah that 73% of the people that they were working with lived in intergenerational poverty. And we just wanted to share, some of the research shows that exposure to poverty from birth to age 15 is clearly linked to an increased probability of being poor as a young adult or into the middle of adulthood. So the numbers are pretty clear that children who are born into poverty are likely to stay in poverty unless we intervene, and that's a lot of what you all who are on the phone are doing to assist people. And one of the strategies that we've been working with that we've found to be very effective with people who face any barriers to employment is customized employment. And it's really although it was developed for people with disabilities, it's a universal design. It's something that has been shown to be effective. It's an evidence-based practice that has been effective with people who face any kinds of barriers to employment or having difficulty figuring out the next step or the right employment match. So we wanted to spend the rest of our time talking about customized employment and some of the strategies. And I will turn it over to Marie to start that discussion.
Thanks, Rebecca. All right, so customized employment, essentially, it's a way of just gathering information in a different way. And so we've heard about gathering information through assessments that may be a little bit more clinical, but the discovery process in gathering information is just asking different questions to learn everything you can about the person, to be able to use that for employment, to be able to use that as a benefit of, as they're seeking and what are they looking for. You've heard of people say, do what you love so you won't be working a day in your life, right? But you have to think about it in a way, what do I love? What do I do? What do I like to do? What do I do for hobbies? And some people, especially folks who have been in, poverty for a long time, they don't think about the things that they love as things that they can do for work. They're thinking of work in a very specific way about what mom has done or what grandma has done or something like that, and they're looking at very specific fields, whereas customized employment allows them to look at things in a very different way and think outside the box a little bit more. And so the approach of customized employment would be discovery, like I said, gathering information, and then from there you create a profile or an employment blueprint, essentially putting together a summary of what you learned, also known as a task list for the person that this thing could be used to enhance their resume at that point. Then you have a customized employment meeting with everyone involved, mom, dad, the person, caseworkers, school, anyone you can that would know something about the person and their skills and their interests and their abilities in terms of gathering information. Then there's informational interviews and networking where you're working with employers to learn about the employer. It's not just, are you hiring, can I have a job? It's more of, I want to learn about you and see where this person or where I could fit into your company, and using your network to discover what employers are looking for, who's out there. We all know someone who knows someone who knows someone, and that could be a job. And sometimes we forget to use that network when it comes to looking for a job. I've worked with a young lady who had been unemployed for, 7 years or something like that. But she knew so many people. She's always been so popular, and she knew so many people, but she never wanted to talk to her network about, I need a job. So it was harder for her to say that, but when she looked at informational interviewing and how to approach networking in a really different way, then the conversation changed from, I need a job, to what do you do? Oh, I can help you with that. And then developing that network into being able to create a position for herself. Another part of customized employment is proposing or negotiating employment. And so we've been taught by employers to put in an application, wait to be called, wait to hear back from them. Even, online many times they say, don't call us, we'll call you. But customized employment has a different approach where you're asking for information about them in a way that's not confrontational, in a way where you're not asking for a handout, you're asking for information to learn more about them to best serve them. And so if you're able to do that, then you can really focus a little bit more on the match. So what is discovery? The first step in customized employment is really discovering about the person, about an individual discovering about themselves, about caseworkers discovering about the person. And again, these are asking questions about the person where you're learning about their interests, their skills, their abilities, their interests and preferences in terms of environmental preferences, geographical preferences. Can they handle a fast-paced environment versus a slow-paced environment? Can they handle lots of people, a few people? The settings are really important. And so these questions allow you to get to really know the person and where they're comfortable. If you're comfortable at work, you tend to stay there a little bit longer. And so really focusing on the person's skills and their hidden talents, their hobbies, things that they do at home that they don't think translates to work. And they're not thinking about it in terms of work because they only know what they've seen. And so this is really allowing an opportunity to think outside of the box and look for those hidden talents and hobbies and those skills that they have that they don't realize are transferable, but they really are. Conditions for employment, as I mentioned, is busy, fast-paced, deadlines, few people, loud, quiet. All of those things come into play when it comes to customizing a position, because when you're going out to meet with an employer, really looking for those things to make that a match for the person who's looking for a job and using those things to make that employer need. And so discovery can help the job seeker know more about themselves, what they really want. You know, there's no job out there. When you look in the paper, did I just date myself? When you look in the online, where you're looking for a job, there's no any job, you know. And so some people I work with, and they come in and say, I just want anything. I'll just take anything. Employers aren't hiring people that just want anything. They want you to want them. And so it's really helping the job seeker focus their interests, focus their skills, focus their abilities, and be able to articulate that in a way that an employer wants them and wants to hire them. So traditional job development strategies, vocational assessments, developing a resume, interview practice, maybe mock interviewing, maybe role playing, responding to job posts, as I mentioned, Craigslist or ads in the paper, if there's still papers around, applications and interviewing, and then waiting for someone to call you back. Customized approach takes a slightly different approach. As I mentioned, you use that discovery to really get to know every single thing about that person, habits, idiosyncrasies, everything that comes about, and then being able to put together a profile that may include picture portfolios or video resumes or a typical resume or a task list based on the things that they know they can do, to be able to take that. And we also use kind of a features to benefits, right? You have one side would be features of the person, the job seeker, and then how does that benefit the employer, what they're bringing to the table. And then being able to take all of that information that you've gathered and then going to an employer to find out information about the business. I want to learn all about you and what you do and what your company does. You're the experts in this field. I want to learn all about this to see how that person could be a good fit. Now, customized employment can be done, I'm speaking mostly from a job developer standpoint, but job seekers can do this on their own, and we'll talk more about that when we talk about guided group discovery or self-guided discovery. But it's all part of the process of how we're negotiating and talking and connecting with employers. Once we do all of that, matching the skills to the employer's needs. Customized employment, as Rebecca said, really started from a job seeker's perspective. However, as I've been doing this for many years, customized employment is it's a customized solution for a business, because businesses are the ones who hire, and so they have to be part of this process. And so it's really matching the skills and interests to the employer's need, and you're thinking about it in terms of two clients, a job seeker client and an employer or a business client, and making sure you're meeting the needs of both. And once you're able to meet the needs of the employer with that match of a job seeker, then it's a win-win for both sides, and everyone's happy, and people tend to stay in jobs that they like a little bit longer. You put together an employment proposal, recognizing the employer's real need. And so most of the time we look at job leads or we look at ads online, and that's their wish list. They want to get the cream of the crop if they can and have everything in there for someone to do every single thing. But when you boil it down to what they actually need, what they're actually paying for, then that's where the proposal comes in. You know, I've talked to employers, and I have a director title now, but you know, there are a lot of directors who go out and direct things, and they make more than entry level or more than, you know, a program director or a program manager or something like that. When I go to them talking to them about youth, this director is filing for themselves. They're doing data entry for themselves, and they're spending 20, 30 hours a week doing that when they could be having a position created for someone who could just do that, and that director can go out and direct something, or, you know, do their more global duties as opposed to focusing on those things. And so that's where that employment proposal comes in to say, this person here can do all of these things that you really need. Let's talk about creating a position for them. So formats of discovery, there are 3 formats that we'll talk about here: facilitated discovery, guided group discovery, and self-guided discovery. We'll talk a little bit more about guided group discovery and self-guided a little bit later, but facilitated, that's what I do most, what case managers are probably doing, job developers are probably doing, where you're one-on-one with the job seeker or the family, you're doing the intake. Now, this doesn't have to take 6 months, 3 months. It doesn't have to take that long. When we do an intake, it might take an hour, hour and a half, maybe 2 max, to be able to ask all these questions and really dive into the background of the person. But it's a living document when you're doing discovery and you're creating this profile for the person. So as you meet with them continuously, you're constantly learning more things about them. So discovery isn't let me do discovery and discover everything I can before I go out to look for a job. You discover everything you can at that moment, and then you go out, look for a job, and you're going to discover more things along the way that will add to your job development plan, add to your goals. But it doesn't have to take a long time to do discovery, because it's an ongoing process if you think about it that way. And the self-guided discovery, and Rebecca will talk a little bit more about that, but self-guided and facilitated is really important, I think, for TANF customers, because it helps them help themselves. Especially folks who, once they get to know themselves, then they're able to network a little bit more. So who benefits from customization? Not just for people with disabilities. Employers and job seekers alike benefit from customized employment. And so this approach can be used for government, it can be used at nonprofits, it can be used in the private sector. It's about the approach, not necessarily the person per se. It's about how you approach business. It's about how you approach networking. It's about how you approach informational interviews, how you approach the interview itself. In many cases you might, or in some cases you might need to ask for a working interview versus a traditional interview. So it's about how you approach employment as a whole. So customization is helpful in that regard. So when we talk about discovery, discovery has been used in a wide range of workforce development programs and with a wide range of partners. We've partnered with American Job Centers, we've partnered with Voc Rehab, we've partnered with developmental disability programs, behavioral health programs, SILs, schools, educational programs. It's about being able to promote, it promotes braiding and leveraging all of the resources, partnering with everyone you can. So where I sit, as working at a nonprofit of Transcend, I sit in the Job Center, and I'm able to interface with VR and with the Job Center and with customers that walk in on a daily basis. The programs that we work with, maybe programs that people apply to, but we're able to still, take walk-ins and see people and help them with whatever they need and be able to provide resources that way. And so, like one young lady I was working with who is a TANF family member. Her mom, Christine talked about earlier, with a lot of chaotic households, or mentioned, multiple disabilities and intergenerational poverty. She was part of that system. She came to us. She was not going to school all the time, hardly in school. She was referred to us from the school because she was hardly going to school. She needed something. I met with her. She was thinking about dropping out and then going back for her GED. Chaos at home. Mom herself had a disability, and so she had her ups and downs. And so this young lady really just needed to work because she needed to get money to help support the family. So she came to us. She was a VR client, but came to us through our summer youth program, where we were able to create a customized work experience for her, which led to a customized position, which now is a traditional position because we were able to do some customization that allowed us to layer on her tasks, allowing her to learn as she goes, as opposed to, here's your whole job description, now do everything. And so a lot of it, like I said, is the approach and how you approach the job, and educating employers as you go along to show them that it doesn't have to just be the way that they're used to doing it. This is a way that this person can do it. Once she learns it, she has it. She just takes a little bit longer in the beginning, and I'm here to support you as a business. discovering values or discovery values. Each stage of this process supports the premise that there's unlimited ways to make a living and make contributions and earn a living. All people are viewed as employable as long as they want to. They can make a contribution to the economy and do well and for the well-being of businesses. Guidance from a facilitator does not mean control. It means suggestions. It means support. It means having someone else there to bounce ideas off of through this process. The individual must be a key decision maker and agrees to take action upon their plan. We can't, as counselors, as job developers, as helpers in this process, we can't make people work. They have to want to work and they have to do some of the work. So whenever I meet with a youth and we're doing an intake and we have part of this process, I have them send me 3 places they're interested in, name, address, phone number, every time. And I don't start job developing until they send me that information. Why? Because looking for a job is hard work and I need them to be part of the process. Just a little bit. They don't have to be hiring the employers that they send me. I want to make sure that we're on the same page, but it's one step for them to take part in this process, depending on the level of disability. So they take part, I take part, and we work together, but they lead everything. More values, there's unconditional acceptance for each person as they are. We start where the person is. If it's not just about, okay, well, you need to learn this before you can get a job. Well, customized employment is about where they are and let's find a job for you as is. You can grow during the process, but where you are right now, what you can do right now is where we start looking for a job and start trying to customize something for that person. It's understood that each person is an expert on him or herself. They know themselves best. Sometimes the questions when it comes to discovery, and we use a positive personal profile, when it comes to those questions, it helps folks think about themselves in a different way, and it helps them think about things that they hadn't thought about before. One question we always ask, what's your dream job? And so many people have never been asked that question, therefore they don't know the answer. And so by the time we're done with discovery, again, it's an ongoing process, but by the time we're done with the initial conversation or by the time we find a job potential for them, they probably have an idea of what that is, but because they've never been asked, they've never thought about it. So we definitely want to ask that. They focus on the strengths of the person, not the perceived weaknesses or their deficits. And so for me, there's a lot of, we get a lot of paperwork in and people want to say, there's this disability, there's that disability. Employers sometimes want to ask, what's the disability of this person? I always go in not knowing. I know enough, but I don't necessarily need to know the specific name because like autism, for example, is on a spectrum. It doesn't matter what the name is. Everyone's different when it comes to the spectrum. So when we're looking for work for Johnny, it's really about what Johnny can do and where his skills lie and where his interests lie. And so we really focus on those things. And when it comes to businesses are used to hiring people to do work for them. They put ads in the paper for people to come and work for them. And so they're looking for us to have them have people focused on their strengths. This person can do this job for you, not focused on the deficits, not focused on disability. That's only part of the whole picture of the person. It's a barrier, but we'll get past that. But they can have these strengths to be able to help them do the job that you need them to do. No two paths for discovery are the same. Everyone's different. So there's also guided group discovery, and that involves self-reflection. It offers opportunities to learn and receive feedback, potentials for anyone. It's potentially for everyone, but it's anyone, not everyone. And so some people need one-on-one approach. Some people need to do self-discovery, but it's another way to be able to have input from other people. Profile for guided group discovery. For participants, they have to enjoy working with others, has one or more barriers to employment, has specific conditions for employment that need to be addressed, has been unsuccessful with traditional approaches, and can stay focused on a topic for at least 20 minutes. And so to be able to engage with the group and be able to provide input to others as well. After guided group discovery, you need to think upfront about other things. who are possible partners? Who will, how will the agencies partner? Who will take the lead? How will services be coordinated? What funding and resources can be braided together or leveraged to be able to help this person find employment? What, if anything, does the job seeker bring to the table? All those things have to be thought about when it comes to group discovery. And then self-guided discovery. This is typically, and I'll let Rebecca talk a little bit more about this, but the people who benefit from, self-discovery all could be.
Thanks, Marie. So, as we talk about the different approaches, guided group discovery is good for certain people who would do better in a small group and who haven't thought through a lot of things, who benefit from hearing ideas from other people and getting more motivation and feedback in a small group. There are some people who would prefer to do it on their own. So people who have had a previous career, perhaps someone who recently acquired a disability but wants to either stay at work or return to work might be someone for self-guided discovery. People who have college degrees, technical certificates, advanced training, or well-developed skills. So self-guided discovery really requires someone who's capable enough to really take control of their employment planning process with some support, but a very light amount of support, rather than having it facilitated by someone else. And people, job seekers receiving TANF or in other workforce system programs who have a disability and who may not qualify for other government-assisted programs that can provide other levels of support. So we've developed these different approaches, the facilitated guided group and self-guided discovery, as they work better for different people who have different levels of need, who are more comfortable doing different things. But, as I heard the description of the Invest in You program, I was able to envision many places where these kinds of approaches could be built into the program. The self-guided discovery facilitation doesn't focus as heavily on the facilitator leading the process, but does get the person to look at when they're at their best. What are they doing when they're at their best? Who are they with? Where are they? What do they care about most? What are some things that people never tire of doing or do without any prompting? And as Marie said, those are the kinds of things that actually there are employers who could use those skills, and the discovery process helps you figure out who those might be. And we'll, in a minute, show you the links to these resources, because we have facilitators' guides and manuals that walk you through the processes, have all the forms that can support you adding these to your programs. These are the roles that facilitators in either process may take. So it could be planning with partners, recruiting participants, presenting material, helping participants to translate the information into employment possibilities. And again, Marie talked about people, finding themes that are coming through their employment, helping people with assignments, making sure that employment plans or positive personal profiles or blueprints are completed, and then providing that follow-along support that Marie talked about. So we wanted to leave you with some things to think about, questions to ask yourself. Are there components of customized employment that can be integrated in your program? And Marie talked about the different components that are discovery and informational interviewing and networking and those kinds of things, negotiating with employers. Are there partners that you're currently working with or that you could work with to integrate components of customized into your program? So as Marie mentioned, we've used these approaches with vocational rehabilitation, the workforce system, behavioral health, developmental disabilities, schools, centers for independent living, many, many partners. So it's something that the TANF program wouldn't have to do alone if there are other partners that are already doing that. Thinking about the challenges you have for getting people jobs, do you see challenges in implementing customized employment? And if you do, please type questions into the chat box and think about next steps you can take to integrate this into the programs that you're that you're doing. And lastly, we just wanted to leave you with some resources that you can use. These are all downloadable, are all free of charge. So this is the guided group discovery curriculum materials. It has a facilitator's manual, a PowerPoint to train facilitators, and a participant workbook that is both a paper copy and an online version that can be uploaded and shared with, if there's shared case management. There's a webinar on guided group discovery. There's a wonderful document on the essential elements of customized employment for universal application that gives you the highlights of what you need to know when working with employers or when working with partner agencies. And there's a self-guided discovery facilitator's guide that walks you through the facilitation process, but also provides you with planning tools, an appendix on how to develop vocational themes, and an employment toolbox that has other forms that can be useful. Mindy had mentioned Section 188 of WIOA. This is a link to the Promising Practices Guide that has lots of promising practices that have been useful elsewhere and is currently being updated. If you're not signed into Workforce GPS, there are communities on the Disability Employment Initiative, the Disability Employment Community, Career Pathways, and there are other technical assistance centers, a job accommodation network, partnerships on employment and accessible technology that has great resources. Mindy's with the National Collaborative on Workforce and Disability for Youth, and there's an employer assistance and resource network on disability inclusion. That's an employer technical assistance center. So there's lots of great resources out there. This is Lead Center's website that has information on cross-system collaboration, customized employment, financial education, and WIOA from a disability perspective. And we also gave you a link to the Drive website, which you can get to through Lead or directly, where you can get state-specific information, resources, data, all kinds of great information about your state and what's happening in other states. And we left you with ways to connect with us. So thank you very much for including us, and turn it back to you.
Okay, thank you both to Marie and Rebecca. And we want to thank all of our wonderful presenters who provided a wealth of important information that we can use in our work with families who are participating in TANF. We're now going to open up the session for questions. So again, we just please ask that you submit your questions using the chat box feature. If you have any questions for a specific presenter, please state so in your submission. You can also submit those questions through the Q&A box as well. So as we begin to open this up for questions, we do have one that can go to any of the presenters. And that question is, and we believe Utah answered this before, is how have you been able to effectively evaluate your impact? So any presenter that would like to address that question.
Hi, it's Rebecca Salon. I think, you know, the question probably was directed to Utah, but clearly the programs that we've worked with where they've implemented customized employment and alternative approaches to assessment, you know, do track all kinds of data, you know, related to employment and career advancement along the way, educational advancement. I mean, that you know, from our perspective, the discovery process and some of the approaches that Mindy talked about as well really connect people to their communities in new ways. I know some programs, you know, look at the extent to which people become less dependent on publicly funded systems as they develop more connections in the community, you know, through coworkers, through community organizations. So I think there are a number of things that different programs track.
Okay, great. And our next question, again, to all the presenters, What is the best way for TANF programs to reach out to ODEP representatives across the country? And anyone that'd like to take that question, feel free.
Hi, it's Rebecca Sandlin again. So ODEP doesn't have regional offices the way that other agencies do, but ODEP can be contacted directly, and we can send out through your Q&A a way to do that. And ODEP can, I think, connect people to technical assistance centers or resources or things like that.
Hi, and this is Mindy Larson with NCWD Youth. I just wanted to say, we can be contacted directly through our website, www.ncwdyouth.info. We have a contact us function on the website. We have our email up there, and of course my email is included in my presentation, and I can be contacted directly. I'm going to go ahead and put the email addresses in the chat box.
Thank you for that. All right. And for our next one, are there any recommended assessment tools to identify learning disabilities and other disabilities that frontline TANF programs may want to consider? And anyone can feel free to respond to that one. Again, are there any recommended assessment tools to identify learning disabilities and other disabilities that frontline staff within TANF programs may want to consider?
And Mindy, you had talked about a resource, right?
Yeah, it really comes down to, as I mentioned, screening first. And so in our assessment guide, there is a tool for asking some questions about learning needs. And so we do recommend taking a look at that tool. Also talking to other education service providers in your area about what reputable tools they might recommend. Our guide has a directory of tools and websites and information. Obviously, a lot of assessment tools are not assessment, but screening tools as well have a cost associated with them. But we have a lot of sort of directory guidance around all kinds of instruments.
Thank you. Okay. If there are no other questions, then we'll turn this back over to Lisa Washington Thomas to close us out. Thank you.
Hi, Stephen. Thank you. And I want to thank all our presenters and all the participants for listening. I think we know that at this time, even though that we have to emphasize work, and that the value of work, and giving people opportunity to be able to address their challenges and help them overcome is something that that's what we're all committed to. So thank you so much. Thank you to all the presenters. Thank you to Amy, and thank you to our peer TA staff, Stephen and Deidre, for organizing. And thank you, Damon Waters, for also helping to organize this workshop. Thank you, everyone, and please fill out your evaluation so that we can continue to have useful and webinars. Thanks, and enjoy the rest of your afternoon.
Thank you, and to everyone as well, a transcript and audio recording of this webinar will be available shortly on the Peer TA website, and that's peerta.acf.hhs.gov. We'd also like to hear from you about future webinar topics, so please send your ideas to peerta.acf.hhs.gov. So again, please help us expand our network and reach a greater number of people by directing interested colleagues from your local and state networks to the Peer TA website. And if you ever do require any technical assistance, please feel free to make that request at that site. We look forward to your participation in future webinars, and have a great day.